Hello, welcome to VMC. I'm Dr. M. Today we are going to deep dive into the topic of acupuncture in veterinary medicine. You'll want to buckle up. This one is a lot of information, so join me. You'll learn something today. Let's start with covering a bit of the history of how acupuncture came to be. The records that we have indicate that it came from China around 3,000 years ago, and maybe it originated as a way to do some bloodletting. Overall, acupuncture seems to be a compilation of a number of religions and philosophies. There also seems to be a lot of tradition wrapped up in it, and so there is a fair amount of variation from one practitioner to the next. At its core, though, people who call themselves acupuncturists will insert small needles into a variety of different places, and they claim that this will cure an entire laundry list of different issues. Some claim to subscribe to the concept of qi, and in this practice there is a belief there are these things called meridians in the body. If these become blocked or unbalanced, that is what results in disease. And so those acupuncturists will insert needles into various points in an attempt to unblock and or rebalance this qi. But there are other practitioners who claim that acupuncture is only necessary to do on the hand and that the entire body can be mapped out on your hand. There's yet another subset of acupuncturists who claim the same thing, except for it's for the ear. This concept originated from the French in the 1950s. The problem with both of the aforementioned is that we have absolutely zero evidence that there is such a thing called qi or meridians. It's not detectable with any imaging or with any sort of other verifiable means of measurement. We also don't have any research at all that verifies this connection of the entire body to various parts of an ear or a hand. To research this took me an incredibly long time because a lot of the information that you find is somewhat contradictory from one acupuncturist to the next. And what I was finding is that there is a lot of disagreement about where specific points are on the body, and there will be a lot of variability from one practitioner to the next. It also seems that the number and location of acupuncture locations changes quite a bit over time. To add additional confusion, some people will burn herbs near needles that are inserted. Other people will apply electricity to the needles while they are inserted. Other people don't insert needles at all. They just use the sites for massage or for laser. And I haven't even addressed the fact that there's an entire subsection of acupuncturists who poo-poo the notion of qi and vital forces, etc. And they claim that actually acupuncture works because when you insert the needle, it releases endorphins in the patient's body. So this subsection of acupuncturists are trying to stimulate endorphins or blood flow or nerve function. When I was reading about this, I went, oh, this realm of thinking is the only one that I can somewhat make sense. We do know that endorphin release can be helpful with issues like chronic pain. So I thought, let's see what the research is showing us, and does this somewhat logical train of thought actually work when it's applied. The lack of agreement on what acupuncture is and how and where and when it should be applied does make researching it a lot more challenging. That said, so many people over hundreds and hundreds of different research studies have tried to prove that acupuncture actually works. Now, we have to be aware of a number of different biases when we're delving into this topic. There's also immense variation in the quality of the studies, and here we also have some challenges because it can be very difficult to blind human patients to whether or not they are receiving acupuncture, and it's also going to be impossible to blind the acupuncturist. As far as placebos go, those tend to fall into two different camps. There are now sham acupuncture needles that some studies will use that don't actually insert anything. And then there are other studies where the placebo acupuncture will insert the needle into a location that's not supposed to treat what the research study is trying to treat. We will end up feeling a lot more confident about findings of studies on a specific topic when we have repeatable, verifiable results that come from a number of different researchers from different countries around the world over time. We also need these trials to be as well designed as possible. No study is ever going to be perfect. It's pretty impossible to do that. There's always going to be some weakness in every research paper, but we want the research studies to be designed as good as is possible in the circumstance. There are some very interesting results that start to come up to the surface. One, when we do have control groups, that control group will have essentially the same result as the group that undergoes the real acupuncture. What's also fascinating to me is that the human patients who believe that they got the real acupuncture, even if they didn't, will have more of a result than the patients who thought they were in the control group, even if they weren't and they were actually getting the real acupuncture. So to summarize, when we look at all of the meta-analyses that are done on these hundreds, if not maybe thousands of research studies over the decades, the conclusion is that for the vast majority of situations, acupuncture is not effective at all. That said, when we look at two specific areas, nausea and chronic pain, there might be a little bit of value for acupuncture. Now, the results are not as good as medications that are research-based for nausea or for pain, but it maybe helps a little bit. Now, because patients that are experiencing nausea or chronic pain sometimes see a small improvement in their symptoms, especially when they believe they are receiving real acupuncture, this means that it makes the most sense that acupuncture is working as a placebo. So a placebo effect is when, as humans, we believe something is going to help us, and that belief alone makes the intervention somewhat effective. This would explain why acupuncture might be helpful for some subjective conditions for some people, because it's not actually treating the cause of the pain or the cause of the nausea, it's just changing what the patient is feeling about it. So at best, this data is showing us that acupuncture might alter people's perception of some subjective issues that they're experiencing, but that it's not actually addressing in any way the cause for that pain or nausea. So now that we've covered a bit about people, let's move on to talk about acupuncture in animals. I found it very surprising when I learned that acupuncture was not performed on any other species than humans in China. This was not part of the practice or the tradition at all. Humans started doing acupuncture on other species in the 1970s. The theory is that it started at that time because acupuncture was a bit popular in some Western countries at that particular point in time. People started trying to take some acupuncture points that are used for people and tried to translate them. Since we have a lot less research on animals, I decided to narrow our focus for acupuncture in animals down to the two areas of pain and nausea, as at best, those are the two spots where it might have some value. Now we have to be careful here. While the dog or other species might not experience the placebo effect like a human patient does, we do have a well-documented and well-recognized phenomenon called the caregiver placebo effect. And this can affect both the caregivers as well as veterinary professionals. In veterinary medicine, there are two main schools that will certify people. The one is the TCVM, and they subscribe to the pseudoscientific folklore type history. The other is MAV, the Medical Acupuncture for Veterinarians. Now, this group claims that they are wanting to subscribe to research-based practices. Reviews of veterinary medical literature find that there is not sufficient evidence that acupuncture is effective for animals at this point. And I will specifically address a couple of studies that look at pain and nausea. There's a 2016 study by Scallon and Steinman that looked at 80-some dogs, and after they were given opioids that are used for pain management during surgery, the dogs were then either given real acupuncture, a placebo acupuncture, or they were given nothing, and then the amount that the dogs vomited and the number of times they vomited, as well as any other signs of nausea, evaluated. There were very few dogs that vomited across all of the categories. The acupuncture had slightly fewer dogs actually vomit. Across the groups of the dogs who did vomit, they all vomited the same number of times. When we look at other signs of nausea, the acupuncture did not help. There was no difference across all of the groups, which makes it most likely that the number of vomiting dogs was actually too small to get meaningful statistics from it. And then we also have to evaluate this study in all of the other research we have around management of nausea for dogs. We have a bunch of studies looking at using meropitant. That medication is far more effective. So why would you ever use acupuncture for nausea when we have medications that are proven to work way, way, way better? The answer is you wouldn't. Next, let's look at a 2020 study on arthritis pain in dogs. There were fewer dogs in this study, there were only 36, but what they did was all of the dogs received both the placebo and the acupuncture with a washout period in between. So what would happen is the vet staff were not blinded, but the owners of the pets were supposed to be blinded. So the vet staff would take the dog to a treatment room, and if they were in the control group, the dog would just spend time with the people in that room with the same setup, and then when they were actually receiving the acupuncture, the dogs would get the acupuncture in that room. This is a pretty nice way to set up this study because this controls for dogs with worse arthritis pain compared to others. We also need to remember that with so many of these chronic diseases, they will naturally have periods of worsened pain and better pain. For the results, they actually did a pretty nice job here as well. They had some subjective results where they asked questionnaires of both the veterinary staff and of the people who lived with the pets. There were also some objective measurements, there were activity monitors, and there was a force plate analysis done. For the results, both the activity monitors and the force plate analysis showed zero difference. And the same was found when looking at the subjective questionnaires done by the veterinary staff. Now, when the caregivers of the pets were questioned, the results there were a little bit mixed. However, this result can quite easily be explained by caregiver placebo effect. The authors here did conclude that their study showed that acupuncture is not effective. And so again, when I'm formulating plans for my patients that have chronic arthritis pain, I am going to formulate those plans based on the interventions that have a lot of proof showing they actually work. The last thing that we need to consider whenever we recommend any intervention are the risks of that intervention. It's fairly common for issues like bleeding, infection, and bruising to occur. It's pretty rare, but still happens that sometimes lungs are punctured, which can lead to very bad outcomes, including death. Those are all concerning to me. Even more concerning is the fact that people are then spending significant amounts of money seeing an acupuncturist. Meanwhile, the grand summary of all of the research is that it's not effective. And then the people don't have money to pursue research-based interventions and the animal suffers. It also means that there's often a delay in seeking diagnostics and treatment plans, and again, the animal suffers. It's for that reason, at this time, I wouldn't recommend acupuncture for animals. It is in their best interest for us to use research-based interventions that we have a reasonable expectation of actually being effective. But we need to be incredibly careful of all of these pseudoscientific industries that use claims and stories from individuals in order to prove that they work. When they are feeling at their worst is when they might be desperate to try something. And in that desperation, if they try something like acupuncture and then they feel improvement afterwards, they will attribute that improvement to the acupuncture when in reality their symptoms would have likely improved as time passed anyway, because so many chronic diseases have these kind of flares and improvements in symptoms as time goes by. I'll make sure to link a bunch of additional reading in the video description for you. I would love to hear from you what you want me to cover in a future video. I have a list of topic suggestions and I love to add new things to that list, or if things are being requested a lot, I tend to get to them a lot sooner. So if you have something you really want to hear me cover, please comment it down below. And I do put out a new video on most Fridays, so I look forward to seeing you in the next one. All right, bye. I do read every comment from this past week. Here is our comment of the week